You're watching San Antonio Living. Well, polycystic ovary syndrome is a condition affecting millions of women. If you're faced with the effects of PCOS, you're not alone. Our friends at the Institute for Women's Health are here to help. Hey ladies, it's Girl Talk Tuesdays, and we're back at the Institute for Women's Health with Dr. Evangeline Ramos-Gonzalez, who's here to talk to us more about polycystic ovarian syndrome. It's actually very treatable. Tell us about it, doctor.
Well, when the patients return after initial evaluation with physical exam and lab work, we sit down, we go over their results of their labs, their ultrasounds, and then we formulate a treatment plan. And that treatment plan is specialized to each patient depending on what they came in complaining of. The menstrual irregularities was the main symptom. The first-line therapy is going to be hormonal contraception to regulate that. If for any reason they choose not to use hormonal contraception, then we use natural progesterone to help them regulate their periods. For the ladies who are trying to conceive and having difficulties getting pregnant because they're not ovulating regularly, we do have medication, Clomid and clomiphene citrate is the first-line therapy to help induce ovulation for those women and help them achieve conception. And for the ladies who are having issues with the abnormal hair growth or the acne, we have anti-androgen medications such as spironolactone we commonly use, and that helps reduce the male-like hormones circulating in their bloodstream, so it kind of helps reduce the acne and the other symptoms too.
Now, I'm sure this is wonderful for patients who you see during the very first visit who are experiencing the symptoms of polycystic ovarian syndrome. When you see them again, do you see a change?
I do. Once I can regulate their cycles and balance their hormones, all of them will tell me they feel normal again and that they hadn't felt that way in a long time. Polycystic ovarian syndrome can start as early as puberty. So these are young women who, ever since their teenage years, have been having this issue with an imbalance in their hormones. They didn't know what was causing their symptoms or causing them to feel that way. And it wasn't until the symptoms became so exacerbated, like now they're bleeding constantly or having so many issues with the weight being uncontrollably increasing, or now they're trying to start their families and can't conceive. So all these years have gone by that they've had these issues, and when they finally get those hormones balanced, they just feel tremendous. You know, so they really notice a difference.
Yeah. Now, on that note, this could really affect your daily activities. So for girls who are out there, women who are experiencing irregular periods, excessive bleeding, just anything that's not normal, how important is it that they come in and see you?
Well, it's extremely important because what happens is over a long period of time, these imbalances in their hormone levels can contribute to other medical problems such as high blood pressure, diabetes, high cholesterol. From a gynecologic standpoint, our concern is about the endometrial lining inside the uterus. That uterine lining sees a lot of unopposed estrogen, which over a long period of time can lead to endometrial cancer. And so that's the concern, you know, for our young women, is that we try and get their hormone levels balanced before we get to something very, very serious like that.
Okay, thank you so much, doctor. Ladies, now you heard it from the doctor. Polycystic ovarian syndrome does affect your quality of life. Make sure you're informed about it and make sure you come visit the doctor. Dr. Ramos-Gonzalez is at the Institute for Women's Health, 1303 McCullough Avenue, Suite GL70. Give them a call, 226-9705, online, ifwh.org, Facebook, Institute for Women's Health, or on Twitter at IFWHSA. Okay.